Okay, so my name is Florence. I'm 30 years old. 12 years ago, I got a breast augmentation. I was 18 years old at that time. After 12 years, my implant ruptured. It was a really crazy time in the middle of the coronavirus and everything. It was emotional, and that's how I reached out to you. I found through the recommendations, and I reached out directly. The next day it was a Friday when everything happened, and the next day on a Saturday, I got the call from your assistant, and you called me the same day to go over exactly what happened and the rupture of my implant, and you wanted to know more details about it.
Were you scared at that time?
Yeah, I didn't know what to do. It was the weekend, and you think you want to go to the ER to make sure nothing happens, even though in the back of your head, it's my implant was saline water. So in the back of my head, I knew I did that one for a reason at that time. But the panic is there, and you don't know what to do, whether to go to the ER in the middle of the coronavirus. Nobody wants to go to the ER.
That's right.
So I was really scared, and I was really happy. I got the phone call right the next day. So I was able to calm down and think things from another perspective instead of panicking.
So then you came to the office, and we talked about what we had to do at the time, which was to exchange the implants. And this time we talked about saline or silicone, but we elected to do silicone implant. Then I did mention one thing that it kind of got you by surprise, which was I told you I can do the surgery under IV sedation. You don't have to go under general anesthesia. So why don't you tell us what you thought at that time? I know it was in the beginning a little bit confusing.
When I heard that the first time, it was the first time I ever heard it from any other surgeons or anything. So I was kind of scared, and I guess at the moment I got confused with local anesthesia, and I was really concerned that I didn't want to hear anything or feel anything or smell anything or nothing. I just wanted to be out. So I didn't make the decision right away because I wasn't sure. You answered all of my questions, and the day of the surgery, I decided to follow your recommendation and do the IV sedation. And I'm really happy I did, because it was a complete different experience.
Okay, so yeah, we went ahead and did the procedure as planned. Took about an hour, and we found that your left implant was ruptured, as you knew, and I showed you that it was leaking around the valve. I showed you those videos, but it was very, right after I was done, you were already awake. Almost, you remember what you were saying? You told
me that I needed to go to work.
Yep.
I'm traumatized.
So that's great, awesome.
Yeah.
And she kept saying that I'm ready to go to work. And then she just had surgery. So then how do you compare, when you were in the PAC, you actually in the recovery, you were already very awake, and how did you feel this time versus last time when you had general anesthesia?
For me, it was a complete different experience. I was actually expecting the worst because of the pain and the recovery that I had the last time. I had my whole family plan and scheduled to take care of me for like a month. Okay. But it was completely different. I didn't feel like throwing up. I had pain, but it wasn't nothing that I was not able to tolerate. It's completely different of what happened last surgery. Even my mom was like, wow, it doesn't seem like you got surgery compared to last time, because last time it was really, really painful, and getting out of the anesthesia, it was a long process when I did the general, and this time it was completely different. I'm really happy I followed your suggestion and I did it that way.
Okay, awesome. And then, so what about the results? How are you liking them?
I'm loving my results. I'm loving my results. Yeah, I'm really happy. For me, the most important thing was I wanted something to be natural, and sometimes it's hard to find a doctor that understands what you want and what you're looking for. So for me, that was really important, and I'm really happy with my results. I like the fact that they look natural and they complement my body, and it's nothing outrageous or I really like them. Awesome. I really like them, yeah.
Awesome, cool. And then lastly, I was mentioning that we spent a lot of time when we opened our space, in the design of the office, everyone that works here, including myself, and just the way we treat patients, but also in even choosing the colors for the office, the music, the smell, everything to create an experience. So tell me, how did you feel you came into the office, and how did you enjoy it?
I really like the office, the environment in the office, the music is really calm. So like me that I'm coming from a place of panic and I'm like really stressful, and you come here and everything is so calm, the music, the smell, the people, your assistant, Melinda, everyone is so calm. It kind of brings you to that level too, to be calm, and take your time. I really like the office. You guys answer all of my questions. Melinda texted me and called me to answer everything, to make sure all the questions that I had were answered. And for me, that's really, really important. I like the fact that when I'm here, I feel like I'm the only one here. Okay. So I like that individual attention, where it's not like you have people walking in and out all the time, and you're just sitting on the sofa waiting to be seen. So I like that fact that when I'm here, you're like the time of your staff, it was actually dedicated to me. And that's really hard to find, to have someone to answer all of your questions and not being, okay, I have to go, the next patient is ready. So for me, that was really important.
Awesome. Okay, cool. Thank you very much. That was awesome. Thank you for sharing all that.
Welcome. My pleasure.